Welcome, everyone. I'm Tom Farmer, and you're listening to Health Talks. We want to share information between patients, employers, and doctors. Together, we can all make healthcare more accessible for everyone. So every Wednesday morning at 8 a.m., let's spend 6 to 8 minutes on the most talked about issue of the week. Hey, everyone. So this week's topic is, why do doctors charge so much? And by the way, that's the big question we've gotten. Why do doctors charge so much? Well, last year, the United States spent $3.2 trillion on healthcare. Now, that is a lot of money. But guess what percentage of that $3.2 trillion went to doctor pay? I can't hear your answers. I'm going to tell you, though, the answer is 4%. So how many of you got close to that? It is shockingly low. The bottom line is that is not the problem, folks. Now, all of that spending, it does include medications, pharma, all that stuff, which is not related to doctor pay. But the point is, it still shows that the doctor pay really isn't where we need to focus. We keep going back to doctors and giving them rules and tasks and limits. And unfortunately, for many doctors, they're spending an awful lot of time dealing with all of those rules, all of those tasks, all of that stuff. That's not why they got into the business. So when you want a doctor and you're looking at a doctor, I want a guy who's highly trained, who's certified, he's experienced, especially in the specific area of what I need him for. So I'm really glad that they spent so many years in school training, and I do actually want to pay a reasonable fee. I do just want it to be reasonable, though. But I just would like to have an idea of what it's going to cost me before I go in to get that procedure done. So just so you guys know, when a procedure is done, there's generally three components. There's the facility charge. That's, the room that the doctor's renting, whether it's at the hospital or a surgery center. There's the anesthesia charge, because you got to have that so you're knocked out while they're, cutting your leg open or whatever. And then there's the physician fee. So there are other minor charges, that relate to lab work or imaging or things like that, but they're kind of small potatoes compared to these main fees. And of course, if it's an orthopedic procedure, then there are hardware charges that can get pretty expensive. Like, imagine the cost of that titanium screw they're putting in your shoulder when they're doing a shoulder arthroscopy. So, but beyond all that, it's pretty basic and pretty simple. And, when you go to a hospital, like for example, in California, you go to a hospital, the average bill is 800% of the Medicare charges. And so remember that the government is setting these rates for almost every covered procedure that's done. I mean, there are what they call these CPT codes, that there are over 100,000 of them, so that every procedure's done, they know what they're going to pay the doctor, the facility, the anesthesiologist, etc. And what happens is that bill is 8 times the cost of a Medicare charge. So let's say you're 65, you go get a shoulder arthroscopy. By law, the physician, the facility, the anesthesiologist, all of those charges have to be at those CPT codes, quote, the government price. They can't be any more. So I'm under 65. So I go and get the same procedure you just got done yesterday by the exact same doctor, and I'm paying like 8 times more than you paid, 800% of the Medicare cost. Now, to be fair, what happens is the big insurance companies have these huge discounts, and their average discount in California is over 60%. So what happens is that 800% gets reduced to about 300%. And I don't want to get too detailed in terms of those kinds of numbers, but the point is, if you're doing that, you're paying a lot of money and the doctor is not getting that money. The doctor, remember, only gets a portion of that money. So, how do we work this? And that's really kind of the second question that a lot of people have asked, which is, and I'm just going to kind of look at the question here I'd written down, which is, isn't there a way to pay something closer to what someone over 65, on Medicare is paying for the exact same procedure? And I want to tell you that the answer to that is yes. It's called direct pay healthcare. So if we can remove all those costly administrative middle layers of paperwork and bureaucracy, you or your employer can pay for that procedure on the day of service, and you can pay much, much less. And the good news is, just so you know, you're not getting a discount doctor. You're getting a full fee doctor. That doctor is getting his full pay. The difference is all those costly middle layers of insurance and billing adjudication and collections and coding and all of that stuff that doesn't relate to the healthcare cost, that all gets removed and wiped away. So the end result is your full fee doctor gets paid a reasonable price, and let's say it's something like, 150% of Medicare. It's still super cheap to you. It's great for the doctor, which, believe me, that's what you want. You want the doctor to get paid, and it's reasonable, it's easy, and you get the procedure done at a price you can afford. Remember, and I'll just say this last thing, is that we work with a lot of doctors, and doctors entered this profession because they want to do something that's fulfilling. They truly, most doctors, almost every doctor, really wants to do something to help people. Yes, they want to be paid. And by the way, they ought to be paid. Remember, most doctors aren't even entering the workforce until they're about 32. They're going to college, they're going to medical school, they're doing internship, they're doing residency, then they're doing a fellowship. I mean, these guys are in school forever, so they ought to be paid, and you want them trained like that. Remember, though, let's pay them a reasonable fee, and let's remove all the stuff that we don't want to pay for. Anyway, that's today's topic of why doctors charge so much. The answer, in my opinion, is mostly it's not so much. It's all the other stuff. Hey, thank you for listening. Your comments and questions really drive this show, and they actually help us improve understanding for all the listeners. Be sure to leave your comments at www.healora.com/health talks, and we're going to be sure to answer them. Check out the new episodes every Wednesday morning at 8 a.m. Pacific Time. This is Health Talks, powered by Healora.